DC opened its first ever urgent care center in Northeast Ward 7 on Nanny Helen Burroughs Avenue, and its first urgent care center in Southeast Ward 8 on Martin Luther King Jr. Avenue. They've been placed in areas of the city where residents have noticeably an imbalance of both access to health care and health outcomes because of race and wealth. Mayor Bowser and her team, along with the medical staff of Universal Health Services, cut the ribbon on the new Cedar Hill Urgent Care on October 7, 2022 in Southeast DC. The Washington Post noted that the new Cedar Hill Urgent Care is located along the rapidly growing Southeast Corridor on King Avenue in the Anacostia neighborhood, and is owned and operated by Universal Health Services in partnership with the George Washington University School of Medicine and Health Sciences and the GW Medical Faculty Associates. The Cedar Hill Urgent Care is part of a larger hospital system, the Cedar Hill Regional Medical Center, George Washington Health Facility. The mayor and her team broke ground earlier this year on the St. Elizabeth Hospital grounds for the new Cedar Hill Regional Medical Center location, just a couple of miles further away on Martin Luther King Jr. Avenue. The Cedar Hill name is familiar to Washingtonians because the name comes from the Frederick Douglass estate in Anacostia, Southeast DC. This is the house Frederick Douglass lived in until his death and has been made into a National Historic Site and museum. The ribbon-cutting event started with a presentation from Robin McKinney, a long-term Ward 8 resident of DC and an advisory neighborhood commissioner. In a portion of her speech, she said, "I met Muriel Bowser when she was the council member, and she asked me to take a leap of faith and trust her leadership. And I did. And I can proudly say my mayor has invested not in just Ward 8, but in all 8 wards. When she took office, she made sure that DC residents who, for far too long, have been locked out of prosperity that our city has to offer for so many. Now we have a seat at the table." She committed to building economic development, infrastructure, opportunities that will foster homes and businesses in our community. She committed to ensuring that downtown Anacostia, the hills of Anacostia, the avenue of Anacostia would turn into a place where we can eat, shop, and dine. This corridor has been transformed. Just to name a few: Turning Natural, Check It Enterprise of Ronald Moulton, the amazing Anacostia Center, Nubian Human, Mahogany Books, Andy Shallow, Bus Boys and Poets, Children's National Center right here in Anacostia. Let's not forget Anacostia Playhouse, Dion Reader, the Far Southeast Collaborative Office Building, and finally, our healthcare system that will ensure that all our residents have access to full-service hospitals, bringing maternity care back to Ward 8. I remember that Big K liquor store. I think we all do. Numbers of DC mayors have tried to do something with this property, but as with everything, it takes a woman to get the job done. Mayor Bowser, in partnership with the Honorable Council Member of Ward 8, Trayon White, worked to support the development of making View Flats, 114 affordable housing units behind us, the first Starbucks in our community, and now Cedar Hill Urgent Care Center right here in historical Anacostia. The urgent care will offer excellent urgent health care services to DC residents all over the District of Columbia. Mayor Bowser then walked to the microphone and thanked Ms. McKinney for her kind words and for taking that leap of faith with her. She gave a lengthy speech on some of her goals and accomplishments done by her administration. In an abbreviated portion of her remarks, she said, "So I'm Just really delighted to be here today in historic Anacostia to talk about how we have invested and worked long and hard for high quality health care for all Washingtonians east of the river. I want to thank the Universal Health Services Vice President Kimberly Russo, President Mark Miller, Dr. Bass from George Washington University, and their entire team in leadership and partners. I want to acknowledge that we have invested, or will over the course of the next years, $75 million in our healthcare infrastructure east of the river, including this new urgent care center. I want to acknowledge that even before we deliver the new hospital, it's gotten bigger. So just a couple of weeks ago, we announced that we will be adding a fourth floor to the hospital, and that expansion will allow for an additional 48 beds, and it has made it possible by the additional $17 million investment from Universal Health Services. So with today's ribbon cutting, we move a step closer to fulfilling a vision. You've heard us say before that improving healthcare is not just about building a hospital, but about building a system of healthcare in a healthy community. So part of that is opening an urgent care center so that residents are getting the right care in the right place at the right time. So it doesn't mean that you have to call 911 or go on an ambulance or sit in an emergency room. It might mean that you're going to your primary care physician right down the street. We continue to look for locations, and we will for our second center related to the Cedar Hill Regional Medical Center in Ward 7. This urgent care center is what the community asked for. As Robin mentioned, you will come here for prenatal care right in Ward 8, close to home. Patients can get x-rays and blood work, and this is also the place to go if you're not feeling well from asthma, colds or infections, or unexpected health issues. The site will be open 7 days a week from 8 a.m. to 8 p.m., and we expect that it will serve up to 9,000 people a year. My understanding is also that the staff members, 7 staff members, have already been hired, 5 of which live right here in Ward 8. This past week, we've talked about how we as a community will reach a pretty big goal of 20,000 new black homeowners in Washington, D.C. by 2030, and a lot of them are going to be right here in Ward 8. Today we open this urgent care center so we will continue to build healthy and strong communities in all 8 wards. Then Mayor Bowser turned the microphone over to Ward 8 Councilman Trayon White. In an abbreviated portion of his presentation, he said, "We live in a city where the divide between the haves and the have-nots has been increasingly getting wider, and this is an effort on behalf of the government to close that gap. There are a lot of residents living in Ward 7 and 8 that feel undervalued, and so it's our responsibility to make sure that they know that we care. Our residents have long awaited for the same access to amenities as the rest of the city, and today is the day. This facility will be the urgent care facility in Ward 8 and the first of 2 locations east of the Anacostia River. Access to health care is a fundamental human right. Our goal is to build affordable, accessible, and an available healthcare system for residents throughout our city. The Urgent Care Center will meet immediate needs to focus on some of the things that our residents don't need to go to the hospital for. We know in our council hearings that a lot of residents didn't go interact with medical facilities until they went to the hospital, and that was causing the big imbalance in our healthcare system, and it was leading to more infant mortality deaths. We must ensure that all residents have access to equitable medical treatment, and moments like this, we realize the doors are opening to a future that is getting brighter and brighter for those who have been left out of the equation. Mr. White finished his speech by thanking the mayor, the council staff, his staff, all the people that work on the back end, and for all those that don't have titles and the name recognition. Mayor Bowser walked back to the microphone and introduced ex-DC Mayor and current Ward 7 Councilman Vincent Gray. Mr. Gray limped to the podium because of an injury to his Achilles. A part of the speech that he gave, he said, "I'm so excited about the opportunity that we have available to us, and frankly, this is really and a truly exciting day." What a great opportunity this is to be able to create yet another opportunity for people to be served for health care here in the District of Columbia, and especially on the East End in Ward 8 of the District of Columbia. The reality is, at least in my opinion anyway, that we're creating a true health care system on the district's East End for the first time ever. MBI already created an urgent care center in Ward 7, and a second one will open at the end of 2023. We hope by the end of 2023, maybe a little later than that, but it will be soon. I'm really excited to be able to also talk about our 184 bed, isn't that wonderful? 184 bed GW Health Cedar Hill Health Center, and we'll see that right here. And an adjacent ambulatory healthcare center that will open in early 2025 on the St. Elizabeth campus. I want to thank you, Trayon, for all the work that you're doing as a council member for Ward 8. I want to thank you for being a good colleague and a good friend also. So let's all recognize that when we cut the ribbon tonight, we're opening the door of opportunity for so many people who just haven't had the chance to be able to have these services available. We've had a United Medical Center and other services available, but we know we can do better than that. Mayor Bowser returned to the microphone and said, "Next, I want to introduce our partners in this work in the urgent care and also our new hospital. First, Kimberly Russo, who I've mentioned, who is with Universal Health Services, who will operate this facility and our new hospital." Kimberly? Kimberly Russo walked to the microphone, and in an abbreviation of her speech, she said, "I'm really thrilled to be here today to open and celebrate the new Cedar Hill Urgent Care GW Health. This is a vital addition to the health services east of the Anacostia River. As many of you know, and you have heard today over the past several years, we have proudly partnered with the government of the District of Columbia to create a true comprehensive healthcare system to better meet the needs of our region and the communities of Ward 7 and 8. Opening Cedar Hill Urgent Care here in historic Ward 8 is the first step in creating this robust academic medical network, which will enhance access to equity and the outcomes in our nation's capital. I'm happy to announce that the Cedar Hill Urgent Care GW Health will open its doors to patients this Monday, October 10th at 8 a.m. This facility would not be possible without our partnership with GW University, the GW School of Medicine and Health Sciences, Dr. Dean Bass, GW Medical Facility Associates, and our physician partners who are providing the care. The urgent care will be here 7 days a week to serve this community from 8 a.m. to 8 p.m. This will allow us to serve the district residents for a long time coming. The Cedar Hill Urgent Care will provide comprehensive services for a wide range of everyday illnesses, such as colds, flu, ear infections, sprains, minor COVID, and cuts and burns. The urgent care will also provide basic lab and x-ray services to the community. The Cedar Hill Urgent Care GW Health will be here in the future, fully integrated with the new Cedar Hill Regional Medical Center, which, as you have heard, is opening in early 2025 on the St. Elizabeth's campus. We will also be proud to open a second urgent care facility, hopefully sooner than the late 2023, early 24, in Ward 7 to help establish this robust, coordinated system of care for all district residents. Ms. Russo finished her speech by thanking the mayor, the deputy mayor, Wayne Turnage, council members Vincent Gray and Trayon White, the ANCs of 8A, and many city officials as well as our own team. Then Barbara Bass walked to the microphone and introduced herself. This is a small portion of her speech. My name is Barbara Bass. I have several hats at George Washington University, but I am in this capacity the Dean of the School of Medicine and Health Sciences, as well as the CEO of the Medical Faculty Associates. That's the group that is so excited to be here, to be part of launching this incredible new medical enterprise integrated into our systems, currently over there on the west side of the city. To really enhance the level of care, we can say, I have in the back of the room here several people that are part of our enterprise, including a couple of our chairs of the departments. Dr. Rob Cheshire, who chairs our Department of Emergency Medicine. Dr. Bill Borden of Medicine, and I also want to call out two physicians, Dr. Lee and Dr. Davis, who are going to be here on Monday, and who have all the way led the development of this fabulous system. As I mentioned earlier, the Cedar Hill Regional Medical Center, GW Health, is expected to open in early 2025, replacing the United Medical Center Hospital, which has been suffering from financial problems and mismanagement for decades. The second urgent care facility from GW Health will open in 2024 in Ward 7. Now let's take a look at the MBI Urgent Care Center that already opened in Ward 7. MBI Urgent Care is the first urgent care clinic east of the Anacostia River in Washington, D.C., with the grand opening on March 31st, 2022, with Councilman Vincent Gray. They are open 24 hours a day, 7 days a week. MBI Urgent Care provides affordable and timely medical treatment to children and adults and address sudden, non-life-threatening injuries and illnesses. Treating patients depending on their diagnosis will be able to do stitches and sutures, broken bones, cuts, fractures, lab tests, x-rays, vaccinations, blood pressure checkups, blood work, colds, skin infections, constant nausea, and more. The clinic accepts scheduled appointments and walk-ins and is located at 5140 Nannie Helen Burroughs Avenue, Northeast DC. Actually, this new urgent care is located directly across the street from a DC landmark that I have taken you to in previous videos. It sits directly across the street from the old Strand Theater and the new Strand Residences apartment building. Nannie Helen Burroughs Avenue is in a redevelopment area now. The new urgent care clinic was transformed from an old office building that sit at the edge of a lot that shares space with a now closed fast food restaurant and a church. The owner of the Holy Christian House of Praise Baptist Church first sold the office building, which is now the MBI Urgent Care. The carryout in the church was sold to developers who plan to change that lot into a mixed-use development. The Warrington Group has applied for a planned unit development for the parcels 5110 through 5140 Nannie Helen Burroughs Avenue in hopes of delivering over 180 units above retail space. The Zoning Commission granted a 2-year extension to the newly named Deanwood Town Center, giving the development team until July 2022 to file for building permits. The units will have up to 1 to 5 bedroom apartments. 61 units will be replacement units for Lincoln Heights and Richardson dwelling residents, and 104 will be made affordable housing. The church was built in 1961, but will be raised to create 2 levels of parking space beneath the second floor courtyard of the first of 2 buildings, providing a total of 143 parking spaces and 52 bicycle spaces. Amenities would include a fitness center, kids playroom, and club room, in addition to a shared courtyard. The plans for the new development were announced in 2017, but delays has put this project on hold multiple times. So far, the only new announcement I could find was this one. The plans for the development of two mixed-use buildings with more than 180 multi-residential units as of July 8, 2022. This project is in schematic design, but pending tax credits. Information regarding the selection of a general contractor has not been released. A timeline for construction is unavailable. Square footage provided is for retail portions only. Many journalists and bloggers are saying Deanwood is experiencing an urban renaissance with its commercial development of residential and retail. Its proximity to the I-295 highway, its public transportation, and its new retail development makes Deanwood the new hot neighborhood in DC. This corridor is also supported by the Great Streets Initiative, a grant program that provides up to $50,000 to small businesses. It's designed to support existing small businesses, attract new businesses, increase DC's tax base, and create new job opportunities for DC residents. As for the new Deanwood Town Center development, the question is, when are they going to build it? But as for now, we can celebrate a new urgent care center in Ward 7 and another one in Ward 8. I'm Dickie D, your DC tour guide, and I want to thank you for hanging out with me in another neighborhood and riding with me to another event. I will see you in the next video.